So what is osteomyelitis? It's a bone infection that occurs normally due to an open wound. Many times you can try antibiotics, but unfortunately, with the amount of the bone that's infected, it's very difficult for the antibiotics to get through and to clear the infection. The number one reason for amputations in the world is people with diabetes, neuropathy, and a non-healing ulceration. Good day. How are you all today? Thanks for joining me. Today we're going to talk about something that's really important that we see a lot of here, unfortunately, in the Rio Grande Valley with patients with diabetes, and that's what we call osteomyelitis. That's a big word, and I know probably a lot of people say, what is that? And what it means is that you have a bone infection in the foot. And it could be a bone infection anywhere, but because I'm a podiatrist, we're going to talk about the feet. So what is osteomyelitis? It's a bone infection that occurs normally due to an open wound. So someone comes in with an ulceration that's been open, let's say for 3, 4, 5, sometimes a year, and it's been open that long, and bacteria gets into the bone and the bone becomes infected. So what do you see when you have a patient that comes in with, let's say the big toe's infected? What do you see? Again, normally you see an ulceration. Lots of times it'll track to bone. So if I take a Q-tip and I touch that area of the ulceration, you'll see that the bone is palpable. You can touch the bone. When that happens, you have an 85% chance that you have a bone infection in that great toe, for example. Also, it can become acutely infected, which means you have redness, swelling. You could have pus coming from the area. You could have necrosis, which means dead tissue. All that together gives us a diagnosis of a bone infection or osteomyelitis. Well, how do you treat osteomyelitis? That's a great question. Many times you can try antibiotics, but unfortunately, with the amount of the bone that's infected, it's very difficult for the antibiotics to get through and to clear the infection. So many times what we recommend is a debridement, a cleaning of the bone. We take out some of the bone so that the antibiotics have a better chance to get in there and work. Now, sometimes there's so much infection, the soft tissue envelope, the tissue that surrounds the bone is dead or it's infected so badly, we can't save that toe. And we may have to do a partial toe amputation or the entire toe. So osteomyelitis occurs when you have a bone infection. The treatment options are debridement, amputation, or antibiotics. But like I said before, antibiotics alone many times just doesn't work. And so you want to clean the bone a little bit to get the antibiotics a better chance of working. The number one reason for amputations in the world is people with diabetes, neuropathy, and a non-healing ulceration. This is one of those times when time doesn't heal all wounds. And you'll hear me say that a lot. You need to get care. If you have an ulceration on your foot, and if you think you have a bone infection, give us a call at Futuro Clinical Trials. We have clinical trials dealing with bone infections, osteomyelitis, that can try to help you heal and save as much of your foot as possible. Go to our website at futuroct.com. Look at what we're doing. Give us a call. My coordinators are available to help you decide if our study might be for you. So please give us a call, 956-999-8399, and ask one of our coordinators, I think I may have an osteomyelitis, a bone infection. Can you help us? And hopefully we can. I'll see you at the next time. Take care.